I understand jurisdiction is messy, especially in health. Minister, we heard from one of our witnesses about a solution that is not predicated on negotiations with the provinces, and that is the proposal to create a Canadian home care allowance for senior citizens, a direct transfer of money to people to pay for specifically home care. Can I get your response to that proposal?
I think it's an intriguing idea. Obviously, there are challenges as well in an approach like that, to make sure that it would be of sufficient amount, that it would be, that there would be access to those kinds of home care in the jurisdiction in which the person lives. There are a number of challenges, but I'm looking forward to seeing the proposed idea. Again, I think, I think about the rural communities that struggle with access. I represent a riding that is partly urban and partly rural, and even with provincially provided home care, it can be a very precarious patchwork for people that are living outside of major centers. And I go back to the challenge of home care workers themselves and the precarious wages that they earn. And so I don't know, many people on this call probably have lived this experience, but having had an aging person in my life and working through the home care system in Ontario, there is nothing more difficult for both the person receiving the care and the family member to get a call that morning that the care worker can't come to the house to provide the care. And those kinds of things are, as you know, often related to the unstable workforce that is related to conditions of work.
So, Minister, you're speaking to a customer of home care. As my aging mother lives with me, and I can not describe to you in enough detail how challenging that it is to work with the provincial system. So I have opted for one, to opt out of the provincial system and just simply do it privately.